Wellness Pro conference, and it's a great opportunity to be able to share my personal experience. And I can tell you that the day prior to coming, I called the organization to tell them that I wouldn't be able to make it. I was laid up in the hospital, Mount Sinai Hospital in Miami Beach, and I'd lost the use of my left leg. Just insidious, woke up that morning and there was no left leg. The pain was excruciating and there was no pain in the leg. That was in another location, but the left leg wasn't functioning. And I can tell you that the following happened. Being a practitioner in the area, went to see some very fine practitioners, went to my orthopedist. My orthopedist ordered a bone scan. I wanted to be at this conference. I said, well, let's do it now. He cut the red tape, and I had an opportunity of having the bone scan within, that following afternoon. I received a phone call from him telling me that it was not good, that they had found some hot spots over the lower portion of the spine, which indicated possibly a lot of very bad things. Needless to say, there was the need to now do an MRI to be more specific. So that evening, at 10 o'clock at night, I was going through an MRI evaluation. After seeing the films and getting the results back and hearing from the radiologist and then speaking with the doctor again, I was advised that there was a growth, a cyst, in the left inferior facet joint of L5-S1, and that was shutting down my leg, and that they were going to have to go in with a needle, aspirate it, see what it was, and of course it could be of those things we don't even want to think about, to the least being a synovial cyst, but in either case a growth nonetheless. The following day, I managed to get into my orthopedic surgeon's office, a different orthopedist, who went in and aspirated the joint, took out several cc's of fluid, and then did a nerve block, what they call an epidural. I was in more pain following that procedure than I was when I went in, and I still didn't have the use of my leg back. I was told, well, there are no guarantees in medicine. We did what we were supposed to do. Let's give it a couple of days and see what happens. But of course, being a professional myself, a better outcome would have been unlikely. I went home and I called the organization and told them that I'm not going to be able to make it. And Matthew advised, well, you have a unit, open the box and do it on yourself. And of course, I wasn't in the best of moods, and I just didn't want to hear anybody's advice at that point. I was checking on my life insurance policy. I opened the box, and without much experience in using the equipment, because I had just acquired it, I was able to be totally relieved of the pain and got most of the use of my left leg back within a short time following the use of the unit or the application. And I can tell you that I called him back and I said, okay, I'll be there. I said, but I'm only going to come if you're going to have somebody more competent, somebody who has more experience with the unit, to give me a treatment. Got on the airplane. It's just an hour flight. Got off the airplane, which re-exacerbated all the problems, and probably because of the cabin pressure or what have you. I hobbled over here. I had to use a wheelchair from the gate from the airplane to the baggage claim, and was in total misery. Hobbled in here the day, the evening before the program, and Matthew got one of the well-trained individuals on the unit. 15 minutes later, after the procedure was over, pain-free, total use of my leg, and delivered a full program today. And not that I'm going to in front of the camera right now, but I could do a soft shoe. I have no symptoms and full use of my left leg. I am not surprised, because I know this technology works. I know this equipment's the best that there is out there at this time, and I know that it's getting better every day. I'm aware of some of the innovations and modifications that are being worked on right now that will be out in a few months, and I'm real excited about that. I can tell you that it's a dangerous procedure a lot of possible side issues when doing aspirations and breaking skin, invasive work like that, and epidural blocks. But I was desperate. If I would have spoken to Matthew before, I probably wouldn't have needed that procedure. But I can tell you that I'm a happy camper, and I certainly hope that those that are listening can appreciate my situation. It certainly wouldn't be very different from anybody else's with a similar scenario. So I recommend it. Absolutely recommend it.